Hi everyone, welcome back to this channel. This is Dr. Farida Rajan Ibrahim Omasundi. So today we are going to discuss preeclampsia, the classifications, definitions, symptoms, as well as management. And if you are new or you haven't liked this channel, please do like, share, and subscribe. So what is preeclampsia? Preeclampsia is a pregnancy-specific hypertensive disorder that usually develops after 20 weeks of gestation or earlier in molar pregnancy, and this is characterized by hypertension which is greater or equal to 140/90 on 2 occasions 4 hours apart, and proteinuria with a protein-creatinine ratio of about greater or equal to 0.3. So if proteinuria is absent, diagnosis can still be made if hypertension is associated with maternal organ dysfunction or uteroplacental dysfunction. So what are the risk factors for preeclampsia? So the various risk factors for preeclampsia include first pregnancy, extremes of maternal age, where this woman is below 18 or more than 35 years of age, multiple gestation in terms of twins or triplets, previous history of preeclampsia, family history where the mother or sister suffered from it, pre-existing hypertension, chronic kidney disease, diabetes, obesity, autoimmune diseases such as SLE and antiphospholipid syndrome. So coming to the pathophysiology, first and foremost, there will be an abnormal trophoblastic inversion or spiral arteries, which will lead to poor placental perfusion. And there will be placental ischemia, which will lead to release of anti-angiogenic factors and inflammatory mediators. So these cause endothelial dysfunction, resulting in vasoconstriction, which will lead to hypertension, increased vascular permeability, which will lead to edema and proteinuria, and there will also be procoagulant state, which will lead to thrombosis and HELLP syndrome. So what are the clinical features for preeclampsia? So I'll divide it into maternal features as well as fetal features. So for maternal, we can have things such as hypertension, proteinuria, edema of the face, the hands and the legs. They can present with headache, blurred vision, epigastric pain or right upper quadrant pain if there is liver involvement. They can also present with oliguria, hyperreflexia, clonus. So for the fetus, they can have intrauterine growth restriction, oligohydramnios, placenta abruption, and stillbirth. So what are the various investigations that we can do? So on the maternal side, you can do the BP monitoring, you can do urinalysis, and there will be presence of proteins in urine. You can do your full blood count, which will show reduction in platelets, and in case of HELLP syndrome, you can do also urea creatinine for the renal function. You can do the liver function test, and you can also perform a coagulation profile. For the fetus, you can do an ultrasound to monitor growth, amniotic fluid volume. You can also carry out an umbilical artery Doppler. You can do your CTG for fetal well-being as well. So coming to the classification, mostly we can have mild preeclampsia and severe preeclampsia. So for mild preeclampsia, this is where the BP is greater or equal to 140/90 but less than 160/110, and can have presence of proteinuria and no end organ damage. So take note of that, there is no end organ damage. But for severe preeclampsia, this is where the BPs exceed or are equal to 160/110. there is heavy proteinuria and or evidence of organ dysfunction, where we can have things such as renal failure, liver dysfunction, thrombocytopenia, cerebral or visual symptoms, pulmonary edema, and so on and so forth. So what are the complications? So coming to the maternal side, the complications include things such as eclampsia, where we can have the presence of seizures, HELP syndrome, where there can be hemolysis, elevated liver enzymes, and low platelets. You can have DIC, stroke, cerebral hemorrhage, pulmonary edema, acute kidney injury, and placental abruption. And for the fetal side, you can have things such as intrauterine growth restriction, like we've already discussed, prematurity, hypoxia, and stillbirth. So how do you manage this condition? So for the general management, you can admit the patient if severe, and you encourage rest. You have to monitor the BPs, you monitor the urine, you monitor your labs as well. And you can give antenatal corticosteroids if the pregnancy is less than 34 weeks for fetal lung maturity. You can give your antihypertensives, and you can also give seizure prophylaxis. You can give your magnesium sulfate, which is the drug of choice. Yeah. And for the definitive management, so mostly the definitive management is the delivery of the baby and placenta, which is the only cure. Yeah, so the timing depends on the severity and gestational age. So if the pregnancy is greater or equal to 37 weeks, you deliver. If it's below 37 weeks, if severe and there is maternal or fetal compromise, you deliver regardless of gestational age. And if there is mild and the patient is stable, you can monitor until fetal maturity. Yeah, so that's a brief discussion on preeclampsia. See you in the next video. Thank you.